Thank you for staying with us and welcome to the news at this hour. The Nigeria Association of Resident Doctors has resolved to embark on a 5-day warning strike beginning from Wednesday, that is tomorrow. The doctors say they have presented several issues bordering on patients' doctors' welfare to the federal government without getting any invitation for dialogue from the government. The resident doctors also added that after their last extraordinary executive council meeting between the 27th and 29th of April, they issued the government a 2-week ultimatum to address the burning issues presented. The ultimatum ended 3 days ago. Well, President of the Nigeria Association of Resident Doctors, Orji Innocent, joins me via Zoom from Abuja for more on this developing story. Thank you for joining us on the news.
Thank you very much, Veronica.
Now, sometime, I think 2 weeks ago, the Minister of Labor and Employment, Dr. Chris Ngige, said that the federal government has met all the demands that the resident doctors were requesting and was wondering why the association was seemingly having a sense of entitlement mentality. I wonder what your reaction to that is.
Thank you very much for having me. The Nigerian Association of Resident Doctors National Executive Council had an extraordinary section in Abeokuta, FMC Abeokuta, on the 28th of April 2023, and the next day we issued our 2-week ultimatum to government to address numerous challenges bedeviling the health sector and ultimately affecting our members and Nigerians in general. Those issues ranges from the grossly inadequate manpower in our hospitals, the shortage of staff, inadequate infrastructure. We also talked about immediate upward review of our consolidated medical salary structure, the payment of 2023 medical readiness training funds, the withdrawal of the obnoxious bill by Honorable Gani Johnson, which seeks to enslave Nigerian doctors. The numerous challenges in our various state tertiary health institutions across the country. These issues are very specific, and they have not been addressed up till now. In fact, at the expiration of the ultimatum, by the time we were meeting yesterday, our members noted that there was no attempt by the government to even call us for negotiation. Now, the issue, because the essence of issuing an ultimatum is to raise an alarm to the government and indeed to Nigerians that we have challenges that need to be addressed. And if that ultimatum will expire without any attempt by the government, by the Ministry of Health, that is our parent ministry, to call us for discussion, then I don't know, how to describe that. And our members analyzed this yesterday, and it was even a push for an indefinite strike action. But we considered the incoming government of Senator Bola Ahmed Tinubu, and we felt that it will not be a good welcome for him to be taken over at the time that the health sector is in crisis. And therefore, we tried as much as possible to assuage our members to just limit this to 5 days warning strike, hoping that before the expiration of that 5 days, and indeed before next week or between now and next week, both the current government and the incoming government should try and look at the issues we have presented to the table and address them. We have a lot of issues. In fact, so many of these issues can be resolved within days. They are not things that should be left for the incoming government to come and start grappling with. And we are calling on them.
So what was your engagement like with the Ministry of Health? Was there never an engagement? Because I mentioned earlier that the Minister for Labor, Chris Ngige, had said that the demands that your association had made had been met. And I wanted you to address that because I'm wondering where then are all of these issues coming from? If he is saying that or claiming that the federal government had met all the demands.
The reason I took my time to enumerate the demands we've placed on the table is we are all Nigerians. I was specific in those demands. They have been in the public space. let them provide evidence that they have met those demands. 2023 MRTF has still not been paid. The upper review of consolidated medical salary structure, which they set up committee in the Ministry of Health last year. In fact, throughout this year, they didn't even meet. So the circular has not come out. There is this brain drain committee that was set up last year by the Ministry of Health to fashion a way of reducing the time it takes to employ clinical staff who are leaving the system in droves. And that, because what we have now is that for you to employ any clinical staff in the federal institution, it will take you not less than 8 months because of the bureaucratic bottleneck. So that committee resolved and came up with a guideline that reduced that time it takes to employ clinical staff to 3 months. The report of the committee was submitted in February this year. 3 months later, the circular is there to come out. These things are specific. I'm talking about specific things. They have not been addressed. You know, we have salary areas of 2015, 2016, and 2014. We have issues in our state tertiary health institutions. The bill by Honorable Ghanaian Johnson has still not been withdrawn.
So well, it has, because a report, it has. That bill has been withdrawn. A report this afternoon that I saw, the federal government has described that bill as unworkable. And so that seemed to have been thrown out as it stands.
Withdrawn. If they have withdrawn it, they should give us evidence. It's even good that the federal government has now come out to condemn the bill, because what our members have been telling us, you know, all this was that because they have information that some interest in the Federal Ministry of Health are even the one, you know, sponsoring and supporting that honorable member, because we know that even the brain drain committee I talked about that started last year tried to even bring up policies that will forcibly restrict the movement of Nigerian doctors, which is against the constitution. So we were able to stop them at the level of that committee. So our members feel that they went behind to now start to use the parliament to bring out a law, you know, to still achieve their purpose.
Okay, so with the federal government saying it is unworkable, I believe that one aspect has been dealt with. But we must thank you, President of the Nigerian Association of Resident Doctors, Orji Innocent, for your time on the news.